talk about the screening. So how does that work? How do you do your screening?
Yeah, okay, so screening is an important part of physiotherapy practice, regardless of the setting in which you work. Every country in the world is a little bit different in how physiotherapists work. Now, I know in New Zealand, physiotherapists are primary contact practitioners, and we have had direct access to our care for ever since I graduated, so at least 30 years now. So patients can walk in our door having seen nobody else presenting with shoulder symptoms. And the example I gave you earlier of the 55-year-old with the exertional shoulder pain was actually a patient who I saw not so long ago. So we have to be able to make sure that the symptoms that patient presents with are not related to some kind of serious medical condition. Now, even if you work in a country or a healthcare setting where you do not have direct access or patients can't access your care directly, that does not exclude the possibility that a serious medical condition may be present. Now, patients may have already seen medical practitioners, they may have had medical investigations. Not only, we're all human, sometimes things get missed, and also depending upon how long that patient has to wait between the medical assessment and seeing the physical therapist, things can evolve and develop during that time that can sometimes make it more clear that perhaps these symptoms are related to more of a serious condition. So it doesn't matter where you work, what access patients have to your care, we all need to be very aware of what we call red flag indicators of serious medical conditions. And I think that's a fairly standard part of physiotherapy training in most areas of the world. So being alert for red flag indicators, any atypical symptoms or signs that patient may present with, and that's where your clinical reasoning process comes in and your skill at questioning the patient. And even pre-screening. I know in my clinic where I work as a consultant physiotherapist, I screen all the patients for a number of things, including health history. So we use health history forms, which I find are actually probably more effective, I find, than the history taking, because A, it does reduce the amount of time you have to spend going through all this with the patient in the clinic, but also it's very thorough. They have to complete each section, whether or not they think it's relevant. And that's one of the problems, I think, with taking the history verbally, is that patients have come to see you about their shoulder and they may not see the relevance of explaining their family history of diabetes, or, so they may not disclose that information. So the pre-screening, I think, is really important. It's a very efficient way of doing it. It's a thorough way of doing it. And you can include all sorts of questions about health history, surgical history, previous history of cancer, medication use, as well as any specific questions about red flag indicators. For example, recent weight loss, and bilateral neurological signs and symptoms, and those kinds of things. So that screening process is really important to be able to identify the red flag indicators. Having some knowledge, and it depends on where you work. I know in a shoulder specialist setting, you sort of get more familiar with the types of conditions where shoulder pain can be a feature of the process. But being aware and being able to question more deeply about associated body system involvement, other atypical features, and if you have a high index of suspicion that there may be some concurrent medical process, then being able to refer that patient back for medical assessment. There's been some recent work come out, and it's more around identifying serious spinal pathologies. So there's an international framework that's just been released recently on identifying serious spinal pathologies. But I really like the traffic light system that they use. And they use a red light, an orange light, and a green light. And the red light is obviously for patients where they have a number of red flags and signs and symptoms and possibly body system involvement that might make you suspicious of a medical condition. An orange light, and obviously those are the ones that need early referral. The orange light is where there may be a few indicators that there may be a medical assessment might be necessary, but you may initiate treatment in some cases while you work through that medical process. And the green light is more around they really have very few or no indicators of serious medical conditions, and treatment can proceed as normal. So I quite like that red light, the traffic light system. But I think, yeah, the things we need to really be well aware of are the red flag indicators, particularly around emergency conditions. So that would be infections, particularly any evidence of cardiovascular compromise, and certainly any traumatic injuries. And that would include, if there's been a high force trauma, like a fracture, an acute soft tissue rupture that may need surgery, or a dislocation that needs reduction. So those are just a few examples. There are many more, but the red flag indicators for serious emergent conditions, other medical conditions. And I think thereafter, the screening process, one of the other things we then need to do is really check to see whether we think that the symptoms of the shoulder are actually being referred from somewhere else. Now, that may be the cervical or thoracic spine, but in some cases that may be also a visceral referred pain. So we need to be very alert for any sort of atypical signs and symptoms, as well as screening for cervical spine and thoracic spine involvement in the reproduction of those symptoms.